Okay, so I'm going to demonstrate how to measure the blood pressure and how to take the pulse rate before doing exercise. And this experiment, it helps us to know, or in this experiment we're going to see what is the effect of the ANS over the blood pressure and the heart rate and the pulse. So this is a manometer. This is an analog manometer that measures the blood pressure. So it has an arm cuff and it has this dial with a gauge with different numbers that indicates the blood pressure in millimeters of mercury. Also has this inflator with this screw that you have to move all the way up before inflating so you can retain the pressure inside the cuff. And this cuff will go around the arm of the person in bare skin. And the arm cuff, it has to be the appropriate size. So we have this diagram that it tells you that this is for an adult, and it tells you the actual measurement in centimeters, and this is supposed to fit in the person's arm without using more of 2/3 of this arm cuff. So when you tighten it, don't tighten it so much, but don't tighten it so loose. And then here it has this indicator that tells you that you will have this arm cuff over this artery in here. And then you will put this stethoscope with the bell of the stethoscope placed in this part. Now, this stethoscope has these earpieces that faces in an angle. This angle is supposed to go anterior, just like this. Okay, so you can put it in your neck, then you can wrap around the arm cuff, and then once you start inflating, you'll put this stethoscope. Now, for measuring the pulse, there are different areas in the body, but the most common one that we use is the radial artery, which is here in this area. So you will use your middle and index fingers, and then you compress here a little bit, and then you can measure for the entire minute the pulse, or you can measure it for 15 seconds, and then you can multiply it times 4, or for 30 seconds and multiply it times 2, so that will give you the count per minute. So in this case, I'm going to do it just for 15 seconds, and then I will let you know what will be the rate per minute. Okay, so I counted in 15 seconds, I counted 17. So if you multiply 17 times 4, so that will be 68. So that's my number of pulses per minute. And now I'm going to measure my blood pressure. Okay, so I have a blood pressure of, during rest, of 120 over 75. And the way to tell which one is your diastolic and which one is your systolic is by listening to sounds that are transmitted through this stethoscope. And these sounds are called the cortical sounds. So the first sound that you listen to that corresponds to the number, the higher number that you see when the gauge is moving down. So the first sound that is loud and it corresponds to a movement of the gauge like this, that will be your systolic. And then you will hear a series of less louder sounds, consecutively sounds, and then the last one that you listen to and that corresponds to the last movement of the gauge up and down, that will be your diastolic. So while you are deflating the cuff, which you're supposed to do so by moving this screw down a little bit, not so much, because otherwise the air from the cuff will escape really fast and then you won't be able to read appropriately. So you have to just screw it a little bit, and then that will release the pressure of the cuff little by little, and then you will be carefully looking at the series of up and down movements of the gauge and synchronize this movement with the sounds that you're listening to. And then, like I told you, the last less louder sound that you listen to, that will be your systolic blood pressure. Okay, that's all for now. Let me do some exercise and then I will be back.